Alright, today we're going to check glucose levels. That's the amount of glucose or sugar present in your blood. I'm going to use a glucometer here. First you want to check to make sure that the battery is good. This one's a little low, but it should be fine. And then you also want to make sure that you have the correct strips here for the correct glucometer, because if you don't, it's not going to work. So now if you were to do this to a patient, you should put gloves on just in case, because you are working with blood. So with this stick device, you want to take the cap off, and then every time you use it, you should use a new needle. So you're just going to stick the needle in there, and then you take the top off, and the needle is right there. So be careful. You want to stick the cap back on, make sure it's on. So that's ready. So now I'm going to clean off my finger, the one I'm going to stick, with an alcohol prep pad. Okay, and most of them have numbers on them. It's just the depth that you want the needle to go into. So I found that 4 works. So I'm just going to stick myself here. Alright. And you just want to wipe off the first bit of blood. You want to use at least like the second that comes out, just for accurate results. And then you're just gonna stick it in the strip. You should see it like soak in. Okay. So we're gonna stick the strip into the glucometer, and it should take at least 10 seconds to read. Alright, so I am doing mine randomly, and it is about 1 o'clock. I haven't eaten lunch yet, so I haven't eaten at least 4 hours, but I have been drinking coffee with my cream and sugar. So mine is at 75 milligrams per deciliter. So for the normal, it is around like 70 to 126. Pre-diabetes is 127 to 199, and then diabetes is above 200 milligrams per deciliter. So once you get your fingers stop bleeding, you can use a Band-Aid. You want to dispose of the strip in the trash with the alcohol white pad. And then with the sharp, you just want to dispose of it in the appropriate sharps container, which I will do when I get to one. And that's how you check for your glucose levels.